Master. I am a nurse educator for Maternity. In this video, I will cover the contents and layout of the Medline Foley catheter kit, the procedure to use this kit, and a demonstration of Foley catheter placement. Hi Brittany, your doctor ordered an indwelling urinary Foley catheter. I'm going to go get the supplies for that, if that's okay with you.
Okay.
In addition to a Foley catheter kit and clean gloves, you may want extra sterile gloves for a custom size. The front of the catheter kit has a full color picture of the contents. The back side has detailed instructions with diagrams to review placement procedure, perform hand hygiene, and don clean gloves before opening the kit. Hi Brittany, I got the Foley catheter kit.
Okay.
I'm going to have to put your head back.
All right.
And then we're going to put your legs in a butterfly position, similar to when you would get exams before, but we'll have your feet apart. And then I'll be putting the kit on the bed so that it's close to the working area. Okay, perfect. Okay, and we're ready to begin. Position the kit so the first corner opens up and away from you. You'll find the patient education card just inside, English on one side, Spanish on the other side. It is a JACO requirement to give this pamphlet to your patient. I have this education card about your Foley catheter. There's information here about what the catheter is and information about potential infection and ways you can prevent that infection. The under buttocks drape and peri-cleansing wipe are located outside the sterile field. Still wearing the clean gloves and before opening the rest of the sterile kit, use the peri-cleansing wipe and wipe from top to bottom on the perineum. Note, if the catheter is expected to be in place 48 hours or longer, please use TheraWorks prior to using the peri-cleansing wipe. Now you can remove your clean gloves. Use the hand sanitizer provided in the Foley kit or on the wall in the patient's room before donning sterile gloves. It is best practice to open your sterile gloves next to your sterile kit, not on top of the kit. Also avoid turning to your side or behind you for glove placement. Think of your sterile field as a dome centering over your kit. First, you'll find the sterile fenestrated drape. To keep your gloves sterile, pinch the drape near the top of one side, but not too close to the edge. Carefully let go of the drape over the patient's perineum. Do not try to straighten the drape and break your sterility. Slight adjustments can be made later while cleaning the urinary meatus. Work in the direction of the arrows at the top of the kit, starting with the syringe of sterile water. You'll only attach it to the orange port at this time. It is recommended that you do not pre-inflate the balloon for testing. The next syringe is the lubricant to be dispensed into the tray. While both of your gloves are still sterile, Remove the sleeve from the catheter and place the tube in the lube. Moving to the next part of the kit, you'll find the pre-saturated betadine swab sticks. Use your non-dominant hand to visualize the urinary meatus. This hand is now no longer considered sterile and can remain in place for the procedure. Use each betadine swab once, wiping from top to bottom, one for each side of the labia minora, and the final swab midline over the urinary meatus. With your dominant and still sterile hand, hold the lubricated catheter a few inches from the tip. Insert the catheter into the urinary meatus until urine begins to flow. Then advance the catheter an additional 2 to 3 inches. Fill the balloon with the entire 10 milliliters of sterile water and give a gentle tug to ensure the balloon is seated in the bladder. You may now remove the fenestrated drape and your sterile gloves. Perform hand hygiene, don clean gloves, and locate the securement device. Use the supplied skin prep on the inner aspect of the thigh. The Foley securement device has a bifurcation that fits the Y section of the tubing. Smaller tube on the smaller imprint, larger tube in the larger imprint. Be sure to attach the securement device to the tubing before placing it on the patient. Remember, click it, then stick it. Be sure to leave some slack on the catheter tubing when placing the securement device. Check to make sure the access clamp is closed, comparing it to the diagram on the bag. Finally, place the collection bag below the level of the bladder using the bed hooks and avoiding the floor. This has been a demonstration of Foley catheter placement. Thanks for watching.